Take a good look at your fingernails. Go ahead, do it right now, because 5 warning signs of kidney disease could be hiding in them, and most people walk around for years having no idea what they mean. I'm serious. I'm Dr. Frita. I'm a board certified kidney doctor, and today I'm giving you 5 warning signs of kidney disease hiding in your fingernails. And number 4 is sneaky. This is important information to know because 37 million Americans have kidney disease, and most don't even know it. It's called the silent disease for a reason, and that's because kidney disease usually does not hurt. It often does not announce itself, but if you know what to look for, it does leave little clues sometimes, and sometimes the clues are left right on your fingernails. The information I'm about to share with you about the warning signs of kidney disease on your fingernails does not come from just something I saw online or some infomercial. No. As I mentioned, I am a board certified kidney doctor. And so the information I'm sharing with you is coming directly from my clinical experience. So as I break down these fingernail kidney disease warning signs, I want you to pay special attention to number 4 because it is sneaky. And I'm telling you, it is the warning sign that often surprises everyone, including my patients, including other doctors. And then, if you stay with me till the end, I'm going to give you a bonus warning sign in addition to the 5 that we're discussing. And even though this bonus sign is exceedingly rare, it is so specific to kidney disease that when I see it, I can just about predict the diagnosis of kidney disease even before I see any lab work. The purpose of this video is not to scare you, not to make you paranoid, but it's to provide you with evidence-based information so that you can have smarter conversations when you see your doctor, and so that you can share this information with others to empower them as well. Would you like to have a one-on-one conversation with me to discuss your blood pressure specifically, or other medical concerns you may have? Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. Please go ahead and give this video a like and subscribe to my channel if you have not done so already, because I'm about to give you some evidence-based medical information on how your fingernails can be talking to you about your kidneys. Now, of course, in order for you to pick up on these warning signs, you must have fingernails with no fingernail polish. All right, let's get started. Warning sign number 1, pale or whitish fingernails. Your fingernails should be pink, and that pink color comes from blood, and it lets us know that you have good circulation, a good red blood cell count, good oxygenation. Yes, when your nail beds have a pinkish color. If your nail beds are really, really pale or almost white, that could be an indication that something is going on with your kidneys. You see, your kidneys are responsible for producing a hormone called erythropoietin, or EPO. Erythropoietin is responsible for stimulating your bone marrow to make red blood cells. And of course, your red blood cells are responsible for your hemoglobin and carrying around proper oxygen for proper circulation. And one of the signs of good circulation and proper red blood cell count is a nice set of fingernails that are pink. If you have kidney disease, that could affect how much EPO or erythropoietin you're making. And if you have advanced kidney disease, then you are likely not going to make enough erythropoietin, meaning you won't have enough red blood cells. This is called anemia of chronic disease, having a low red blood cell count, or anemia because you have chronic kidney disease. And I'll tell you, other than just anemia of chronic kidney disease, there are other disease processes that can cause you to have pale fingernails, such as iron deficiency anemia. And I can tell you, as a kidney doctor, oftentimes when I see patients, they will complain about having pale fingernails, literally, even before they ever knew about any abnormal lab work, and even before anyone even mentioned kidney disease to them. So how do you test it out? How can you see if your pale fingernails could be connected to anemia of chronic kidney disease? Well, let's do the Blanche test. Okay, I want you to go ahead right now and take your thumb. Take a look at your thumbnail. Press it down for about 3 seconds and then let it go. In a normal scenario, it should fill up very quickly and turn a nice pink color. If your thumbnail remains really pale or whitish, or if it's very, very slow to get that pink color back, then this does not absolutely mean that you have anemia of chronic kidney disease, but it should be enough information to warrant that you call your doctor. Tell your doctor that you failed the Blanche test, or tell your doctor that you have pale fingernails and that you want to be evaluated to see if this could be a warning sign of kidney disease in you. Let me ask you, what were your results of the Blanche test you just did? Did the color in your fingernail come back quickly or slowly? Please drop a comment down below. Warning sign number 2, brittle, dry, or cracked nails. I know a lot of you watching this video have experienced dry, brittle nails, but did you know they could be a warning sign of kidney disease? So if you have nails that are splitting at the tips, or if they peel into thin layers, if they break before they even have the chance to grow, or if they're just like dull and uneven, and they even have ridges formed like in a longitudinal pattern, this could be a warning sign of kidney disease. Here's what happens. Your kidneys are responsible for filtering out and absorbing certain key minerals. Well, when your kidneys stop filtering the way that they're supposed to, then you get a buildup of these toxins and you can develop uremia or uremic toxins in your blood. Take a look at your labs. Go ahead, go to your My Chart right now. Pause for a second. Look at your kidney numbers, specifically the BUN, blood urea nitrogen. If that's extremely high, that means that you likely have these high uremic toxins in your blood and your kidney's not working properly. Take a look at your EGFR as well. If that EGFR is low, especially if it's less than 60, that could also signify that you have high kidney toxins. Okay, well, if your kidney toxins or these uremic toxins are too high, that means that you can have an abnormal processing of minerals like calcium, phosphorus, zinc. And these 3 are essential in you having nice, firm nails. If kidney disease prevents you from having proper calcium, phosphorus, zinc balance, then yes, you can have dry, brittle nails, and that is a warning sign of kidney disease. Now, to be fair, there are other disease processes that can also cause you to have dry, brittle nails, such as thyroid disease, or if you have poor nutrition, and especially in the age where so many people are taking GLP-1 agonists like Ozempic, Mounjaro, Zepbound, Wegovy. If you're taking these GLP-1s and you're not doing it under the supervision of a physician, that could cause you to have extremely rapid weight loss, and it can cause you to have nutritional deficiencies, yes, and that could lead to dry, brittle nails as well. In other words, having dry, brittle nails does not mean that you have kidney disease 100%, but if you are experiencing these nails, and if you don't have a clear-cut reason, then it is worth giving your doctor a call and asking for a kidney panel, like a BMP, basic metabolic panel, especially if you have not had one in a while. It's really interesting. As a kidney doctor, a lot of my patients will tell me once we're talking about kidney disease that they really have had these cracking, dry, uneven nails for a while, but they just didn't really know why. Well, now you know. Dry, brittle nails could be a warning sign of kidney disease. Before watching this video, if someone had told you that your fingernails could reveal something really serious about your kidney health, what would your honest reaction have been? Would you have believed them, rolled your eyes, or would your reaction have been somewhere in between? Please comment down below. Warning sign number 3, terry nails. Yes, terry nails. This is actually something that most people have not heard of. Actually, a lot of doctors have not heard of terry nails. But if you have them, they very much could be a warning sign that you have kidney disease. So here's how they look. Terry nails have a very pale nail bed, okay? So about 80% of the nail is pretty white. But then just on the end at the tip, there is a horizontal band of a reddish or brownish color, okay? So most of the nail is white, and then at the very tip, you have a band of brown or redness. This is the terry nail. Terry nails were named after Dr. Richard Terry, who discovered them back in 1954. Terry nails show up in about 25 to 40% of patients with kidney failure. They're also largely associated with patients with liver disease and with advanced heart failure. So here's how kidney disease is associated with terry nails. That pale color I described that takes up about 80% of the nail in terry nails is due to a combination of low protein, specifically albumin, as well as poor blood flow, both related to poor kidney function. When you have advanced kidney disease, and sometimes even early kidney disease, it can be associated with a low albumin or a low protein in the blood. Tell me this, has your doctor ever checked your urine for albumin with a urine albumin to creatinine ratio, UAC? If so, they're trying to see if you have low albumin that's associated with kidney disease. If you do, especially if the albumin you're losing in your kidneys is extremely high, then it could present as terry nails. Also, having poor circulation from anemia, like we discussed with warning sign number 1, that could also be associated with terry nails because that pale nail you see is from a combination of low albumin as well as poor circulation. When you have very low albumin in your blood and you're leaking out excess albumin in the urine, that can also be associated with swollen feet. Be sure you check out my video on toxic signs from kidney disease that can show up in your feet. Watch that video after you finish watching this video. Now, again, having terry nails is not a 100% indicator that you have kidney disease. It could also signify liver disease, heart disease, or another disease process. But I'll tell you this, when I see a patient with terry nails, I know right away that I'm going to be checking their kidney function tests. I will likely also throw in some LFTs, liver function tests, and I'll also be thinking about kidney disease. So if you're looking at your fingers and you have terry nails, give your doctor a call right away. Now that's warning sign number 3. And I already told you that warning sign number 4 is a sneaky one. And that's the one I'm about to tell you about right now. Warning sign number 4, half and half nails or Lindsay nails. This is the one I describe as sneaky, and I'm going to tell you why. Half and half nails, as the name suggests, occur when half of your fingernail is one color, the other half is another. So the bottom part, the portion of your fingernail closest to the base, is pale, okay? It's whitish. And then about 50% of the way up, halfway up, on the upper half, the nail is a darker color like brown or reddish or tan. The split of this color is about half and half, 50-50, and the line of demarcation is pretty clear. Half and half nails are the most specific warning sign for kidney disease out of the 5 on this list. Yet, most doctors outside of nephrologists, kidney doctors like me, have not even heard of half and half nails. Listen, 20 to 50% of patients with chronic kidney disease have half and half nails. Many doctors don't recognize it. And of course, most patients don't recognize it. They think that their nails just look a little bit off or a little different. But here's what happens. When you have a buildup of kidney toxins, when you have uremic toxins in the blood, that of course affects the circulation to your nail beds. It affects how you get rid of excess toxins. It affects how the minerals and electrolytes are balanced. And as a result, you get these pale nail beds on the bottom half, and then the top 50% will have what looks like excess melanin deposits. It's a pretty distinct look. So when I see patients show up to my office with these half and half nails, I can just about predict what their labs are going to show. They're likely to have low eGFRs, estimated glomerular filtration rates, and relatively high creatinines. Just to give you a little history, half and half nails, also called Lindsay nails, are named after Dr. Peter Lindsay, who discovered them. Please go ahead and take a look at your fingernails right now. If you have half and half nails, take a picture and share it with your doctor right away and ask about your kidney function. Warning sign number 5, Beau lines. Beau lines are horizontal grooves on your fingernails. So they run from side to side. I'm not talking about the up and down vertical ridges. I'm talking about horizontal lines. So your nails are produced from the nail matrix at the base of the fingernail. And if you experience acute kidney injury or some major electrolyte crash from kidney disease, Then when the body is under stress, that nail matrix will literally halt. It'll stop making your nails. And then when you kind of get back to baseline, then the nail matrix will continue to produce your fingernail. And this is marked by the sharp demarcation of a bowline, that horizontal line. It is possible to have more than one horizontal line. If you have multiple bowlines, that could mean that you've experienced multiple kidney disease crashes, or uremia overload, or major electrolyte disturbances. If, for example, you had a hospitalization and you experienced acute kidney injury, acute tubular necrosis, even if you were just on dialysis transiently, if you notice that you have a sharp horizontal line, that is likely a bowline marking that health challenge. So if you see these horizontal lines, these bowlines on your fingernails, it does not 100% mean that you have kidney disease, but it is a timestamp. It means that something was going on with your health, and it is definitely worth taking a photo, sharing it with your physician, and making sure that your kidney health is in good condition. Question: of the 5 warning signs I mentioned today, which one do you think people are most likely to dismiss as being normal, as something due to stress or to the weather or just getting older? Which sign is it, and why do you think people would be most likely to dismiss this one? Please comment down below. And now, you've stuck with me, and as promised, I do have a bonus warning sign of kidney disease that can be found on the fingernails. Now, I already told you this bonus warning sign is exceedingly rare, but it is probably the most specific when compared to the other 5 that I already shared with you. The bonus sign is Merkey's lines. Yes, Merkey's lines. Merkey's lines are 2 pale horizontal lines that appear on your fingernail, and in between the 2 lines, it's a pinkish, normal colored nail. That's it. They're different from the Beau's lines I described earlier because Merkey's lines are not actually in the fingernail, but they're in the tissue beneath. So as the nail grows, Merkey's lines, unlike Beau's lines, do not change. They don't grow and move with the nail. Merkey's lines were first discovered by Dr. Robert Merkey in 1956, and he noticed them in kidney patients with nephrotic syndrome. Be sure to check out my video on nephrotic and nephritic syndrome after you finish watching this video. So, in patients with nephrotic syndrome, there is an abnormal leakage of protein or albumin in the urine, meaning that you have very low protein left in the blood. As a result, it alters the blood flow and the vasculature in the tissue of the nail bed, and it leaves you with these very distinct Merkey's lines. Again, this fingernail warning sign is very rare, but it is so specific to kidney disease. So on the rare occasion that I do see someone with these 2 pale bands with pink color in the middle, I can just about bet my money that I will find a low albumin, specifically an albumin in the blood that is less than 2.2. So go ahead, take a look at your fingernails again. And if you see Merkey's lines, take a photo and ask your doctor to check the following labs. 1, your serum albumin level. 2, have them to do a urinalysis. 3, ask for a urine albumin to creatinine ratio. This will let you know if this is a warning sign of kidney disease for you. So if you stuck with me and you waited till the end, congratulations. Now you know something about fingernails and kidney disease that not only most other people don't know, but even most doctors outside of specialists, they don't know about Merkey's lines either. If you notice any nail changes, remember, you have to look at them in conjunction with other signs and symptoms of kidney disease, like fatigue, like swollen feet and ankles, like easy bruising, like a change in your urine output, like foamy urine. And definitely don't come to these conclusions on your own. Always consult with your doctor. Ask for lab tests like kidney panels or basic metabolic panels. Ask for urinalyses. Ask for urine albumin to creatinine ratios. Talk about your family history. And remember that if you have diabetes, high blood pressure, a family history of kidney disease, and if you're older than the age of 60, then you are at a higher risk for chronic kidney disease. If you notice any of these nail changes, consult with your doctor right away. As a board-certified kidney doctor and as a proud member of the Atlanta National Kidney Foundation Board, it is my mission to educate you about kidney disease and warning signs so that I can help to empower you to advocate for yourself and for loved ones. If you found the information in this video to be helpful and informative, please be sure to like it and share it with others. As always, I want you to do your very best to live your healthiest, happiest life. I'm Dr. Frita.